So we're going to do a few minutes on radial neuropathy, or radial neuropathy. I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner, chiropractor, 35 years, I believe, and this is Dr.
Randall Gates. I am a chiropractor. I'm also a board-certified chiropractic neurologist.
And we have melded these disciplines into utilizing them and creating a paradigm for chronic pain. And creating a paradigm from our experience, from things we've learned from our mentors, and we are currently collaborating on a book. Dr. Gates is doing all of the research and I'm doing the editing of it on peripheral neuropathy. And a lot of folks who are watching this have specifically accessed it because of the term radial neuropathy, but I think you may be familiar with, even if you go for a radial neuropathy or you don't know what it is yet, you go in and you start going on the internet and wondering, do I have diabetes? Do I have a pinched nerve in my neck? Do I have a pinched nerve here or there? So we thought we'd clear that up for you. There are over 80, maybe 80 to 100, I just learned, causes of peripheral neuropathies, and it's a very general term, and we thought we would like to kind of do a little blurb on all of them, which is what we're doing, so that people can have something to access from maybe some practitioners who deal with it quite extensively every day, and frankly get some pretty good results with the ones that are appropriate for our type of treatment. So given that Dr. Gates's discipline involves functional neurology, the brain and the spine, which is the central nervous system, and all the other nerves, which is the peripheral nervous system, I'm going to defer to Dr. Gates to explain to you radial neuropathy, what it is, the nuances of it, and what you might be looking at doing if you have it.
So basically, the radial nerve is one of the main nerves that goes into the arm, and it innervates basically the posterior aspect of the arm, so basically the tricep muscles and the muscles that bring the hand upwards. And the radial nerve is susceptible to injury up here in what we term the axilla, which is the armpit.
Very good.
So for those of you out there using crutches, that can injure your radial nerve as well as some other nerves that go into your arm. Also, sometimes people get injections like immunizations, B12 injections into their deltoid muscle, and if you're a little too far back, you can actually hit the radial nerve. Other causes of radial nerve problems include those where they may have drank too much and they pass out on a park bench or they pass out on some uncomfortable surface to sleep on, and that can actually entrap the radial nerve and cause what's termed a Saturday night palsy. As is termed in the literature.
Yeah, can you do that?
Yeah.
Sleeping like that, like a lot of people.
Basically, yeah, and it will hit the radial nerve if you're pressing on the bench or some other surface in that location. In essence, the radial nerve has a really neat course down the back of the arm, and so wherever it's injured, certain sprouts of the nerve go to innervate the triceps muscles in certain locations, and basically if somebody only has sensory loss in the hand, we know that the nerve injury is farther down in the arm. Sometimes people who do a lot of repetitive trauma may get something like a radial nerve injury that will cause you to lose sensation back here. As you said, neck problems can be in the differential diagnosis, and really a very thorough neurological exam can help to tease out the difference between a radial nerve injury versus an entrapment from a disc herniation, let's say, in the neck, as well as you can get an electrodiagnostic test if your insurance needs verification that you need surgery or something of that nature. So that's basically radial neuropathy. We have...
What's their prospects of recovery?
It really depends on the severity of the nerve lesion.
And what you have.
Exactly. If you have, there are some cases of very severe Saturday night palsies where people are really passed out, and you can actually entrap that nerve enough to cause some lingering damage, maybe not permanent. Whereas lots of times it's just transient. Maybe you have numbness and tingling in your forearm and your hand for a couple hours. I've heard of reports up to 48 hours. But then let's say if you're getting an injection into the arm and you actually hit the nerve, that may be a more long-term process.
Yeah, under certain conditions, the nerve has the capacity to recover for quite some time. It can take time. It can be short, like 48 hours, like Dr. Gates said. if there's real injury, it could take, now they're saying up to a year, they're saying up to 2 years. I think that might be a little bit far out there for these types of things. But,
yeah, and there's grading for all of these
but
conditions.
the point being that the nerve can heal if damaged, if not damaged so much that it can't heal. There's a point where it can't heal. So you got to kind of have somebody who knows what they're doing, do an evaluation on you, and hopefully they can answer that question for you.
Exactly, because neurologists have grading criteria for the severity of the nerve injury. So there's something called a neuropraxia that should be gone pretty quick. Whereas if you completely sever the nerve,
that's
going to be difficult to recover function. You're going to need surgery, and that may still not do it.
Right.
So we have a whole website called peripheralneuropathygroup.com, and there we are posting all of our videos on peripheral neuropathy. As Dr. Rutherford alluded to, really peripheral neuropathy in the lay language refers to when people start to get numbness and tingling in their feet, spreads up to their knees and goes to their hands, can be associated with diabetes or 80 to 100 other conditions. Then we have peripheral nerve lesions, which are a little different, and that's what a radial neuropathy is. Think of carpal tunnel syndrome. That's a peripheral nerve lesion. Those of you who've hit your funny bone, that's a peripheral nerve lesion. Technically, it's a peripheral neuropathy, but on our website, we're going to talk about all of them.
So you may want to define what you mean as lesion.
Lesion meaning where the nerve is injured, where the nerve is compressed.
So it's an injury.
Yeah, exactly, and that can cause symptoms of
It's
numbness,
like a bruise
tingling.
on your...
Yeah, it can cause symptoms of numbness, tingling, weakness, pain, things of that nature. But on our website, we discuss basically every type of peripheral nerve lesion or peripheral nerve problem on the face of Earth, as well as all the different types of peripheral neuropathies that can cause the diffuse, symmetric loss of feeling in the feet, weakness, things of that nature.
Yeah.
So that's what we have to say about radial neuropathy. So thank you for watching.
Yeah. Hope that was helpful.
If you have any questions, go to powerhealthtalk.com. You can also forward them to our Facebook page, as well as sending questions. I don't know if they can send questions or not to peripheralneuropathygroup.com yet, but we'll figure that out. All right.
Okay.
Thank you for watching.
Yeah, hope that was helpful.